I'm seeing more and more that after things like femoral neck bone stress injuries, it's becoming more and more common for it to be recognized that labral and joint pathologies and joint pain is relatively expected. But what is much less appreciated is that it seems to be relatively common for a lot of these bone stress cases to also develop some form of secondary neural irritation on the front of their hips. Now, this is not everybody, but it does seem quite common as you increase load on the quads, increase range of motion through the hip, increase just activity through tissues that haven't been used as much. That nerves on the front of the hip, the femoral cutaneous and the lateral femoral cutaneous, get a bit stiff and a bit tight. And this is something I'm seeing very often and it's very easy to treat. But it often gives patients immense worry because it simulates the pain that they had, just like a labral pathology will as well. And this is something that I think having an awareness of can help manage patients. So I wanted to know, if you're a patient, reach out. Have you been experiencing this? Comment in the poll below. If you're a therapist, have you been seeing this or noticing this, or would this explain some of your patients? Because I also see the same happening down in the tibia, on the inside of the tibia. For some of our posterior tibial bone stress injuries, occasionally there's more of a sural nerve irritation posteriorly, laterally, and then sometimes that also gives them some irritation in the outside of the shin. Same with a superficial peroneal nerve. Sometimes that seems to be giving patients some discomfort after fibular bone stress injuries. These are all things that I think need to be on the differential, because after you have a bone stress and you're reloading, other things get sore. Your muscles, tendons, joints, and your nerves can get irritated as well. And being aware of this can massively reduce fear when we can assess, diagnose, and find it easily. If you're a patient and you're struggling with this, an easy way to qualm some worries, if it doesn't hurt at all like it did in the first place, if the symptoms are kind of random and weird and don't match up, and it's really positional and doesn't like certain positions, those are signs that aren't always concomitant with bone stress injuries. And if it feels tingly and fuzzy or like a weird tightness, sometimes that can actually be more the nerve. Talk to your health professional and get that assessed, because it might give you a bunch of relief.